Thank you so much, Carissa. Hi, everyone. Thanks for joining us today. We know that workplace injury claims can take a toll, not just financially, but also on your operations, your teams, and most importantly, the people that you work alongside. My name is Anna Richter, and I'm the Director of Workplace Health and Safety Programs at SafeCare BC, and I will be moderating today's panel. Today's panel is about sharing real experiences. As Carissa mentioned in her introduction, we're joined by Dana from Broadmead Care Society, Alicia from Louis Breyer, and Tara from the Employers Advisors Office. Together, they're going to walk us through what return looks like on the ground, like what's working, where the challenges are, and how we can support safer, more sustainable outcomes. We hope to keep the discussion honest and practical, and we welcome your questions in the chat throughout. So let's start out by having each panelist just share a bit about what they do in their workplace and what return to work means to them. So maybe Dana, I'll throw it to you first.
Sure, thanks. Like Alicia, I'm the manager of employee health, safety, and wellness. So I get to look at it from all aspects. So prevention all the way to just making sure that employees are enjoying being in the workplace as much as possible. So for us and for me, it starts one with the prevention. So that's education, but also supporting their wellness and taking care of their benefits as well, which is a huge piece for us at Broadmead. We want to make sure that our employees are well supported. And then it goes into what happens when they first get injured, what happens when they're off on an injury, and then how do they come back to work. So kind of a full cycle, and then making sure to track that person as they come back to work, making sure it's durable and it's effective and that it's safe. So really, I get the full circle of the employee return to work process, as it were, from my side. Yeah.
Great. Thank you so much, Dana. Alicia, what does it look like for you?
Good afternoon. And yes, very similar to Dana as the manager of workplace health, safety, and wellness at Louis Breyer. I'm dedicated to promote safe wellness and a positive work environment. I lead the development and the implementation of workplace health and safety programs. I also coordinate the wellness initiatives and support the staff through the return to work and accommodation process. Additionally, I oversee the attendance management program and all the engagement initiatives here at Louis Breyer.
Perfect. Thank you. And I think that's a really important point, Alicia, and we'll probably come back to that around the attendance management program, because I'd love to learn a little bit more about that. So I'll circle back to that one. Tara, what about you as at the Employers Advisors?
So in my role as an advisor, basically what I'm doing is I'm working with employers who are navigating all of these issues. So it can be anywhere from talking about prevention aspects to having just claims questions or anything to do with assessments, and then helping them through that process and kind of sometimes they'll just call to bounce ideas off of us, or this is what we have, how do we make this more efficient going forward? So we're kind of through that entire process with employers, and we also offer seminars where we're actually educating employers and their staff on certain occupational health and safety issues. So there's that aspect as well.
Perfect. And we will put links after the webinar in our resources on how you can reach out to the Employers Advisors Office. Tara, is there a cost to employers to use your services?
No, so everything, well, technically there is because you pay through your assessments. But if you reach out to our office, there's no actual cost and we're not sending you an invoice. Everything's been prepaid through the accident fund. So you can call us with, we always say no question is too small or a dumb question. You can call about anything and we'll help you with that or guide you in the right direction.
Perfect. Thank you. So from each of your perspectives, how do workplace injury claims impact the care in your organization? So not just financially, but operationally and from a human resources on a human level. Alicia, why don't we throw it to you?
Of course, Anna. At Louis Breyer, workplace injury claims affect every layer of the organization. Operationally, injuries affect team dynamics, shift coverage, and patient care consistency. Financially, they lead to an increase of worksafe DC premiums and administrative workload. And most importantly, on a human level, they increase the emotional stress for both the injured employees and their team in general. These injuries can deeply affect the employees' confidence, physical and emotional well-being, and their sense of identity and connection with the organization. That is why we emphasize early support through wellness check-ins, return to work interviews, and ongoing communication to help those employees that have been affected by a workplace injury to stay connected with the organization.
Perfect. And Dana, what does that look like for you?
I would agree completely. I think there's kind of that three-prong piece that she was talking about. There's the financial, there's the individual themselves, and then there's the organization, a larger part as a whole. But I think what we found is that it's a huge culture shift that really happens, right? So if injuries are increasing in frequency or type, like if there's a particular pattern to the injuries that are occurring in an area or department of one of our homes, then that can really cause a cultural shift. People don't want to work there. You know, that might become known in the community, at a much larger community, right? So it's just so important to us, that prevention side, and that we're doing our utmost to make sure that we're supporting the employees prior to injury, during injury, after injury, and making sure that they know that the causes of injuries are being taken seriously and that we're working with them to resolve it, and then that we're supporting them through this entire process, because it is a huge impact that one incident can have on a greater whole, particularly in our industry, because we're working with individuals that have their own wants and needs, right? And that person is likely going to have to continue to live with us, say that they're a cause of an injury. So it's something that's another layer to navigate, as maybe opposed to other industries, I think.
Mm-hmm. You talk about that culture shift. So, and that prevention. So what does that piece look like? What did you do in your workplace to kind of start that shift?
So the first thing we did is we sat down with the employees. They know their departments, they know their areas the best. We need to understand what's going on and really let them hear it, and that we're looking for that, and them drive part of that conversation. Obviously, we can look at trends and patterns from above, but they know their area the best. So that was probably one of the best things that we did. And it was a huge way of them getting to know me better and getting a rapport, because that's also a huge piece of return to work, is if there's a mutual trust there, we're going to have a much better result in the end. So first thing we did is we really dug into what's our main ticket or big causes of injury. And I think they're fairly well known, obviously, within the industry, but diving into the nitty and gritty. And then from there, coming up with education that supports them and making sure that they know that we're investing in them even before they get an injury, right? It's not just, oh, now I've gotten injured and now it's been brought to their attention and now they're paying attention to me. We want them to know that we're looking at this way ahead and that we're trying to stay ahead of injury trends and curves. So I think that was a huge part of our cultural shift, and it had a huge impact on our claims management and our just claim occurrence in general.
That's fantastic. Alicia, I promised I would come back to you about the attendance management, and it sounds like that is also a tool that you're using in your organization for the prevention side of things. Can you share a little bit about what that looks like in your workplace?
Of course. The attendance management program here at Louis Breyer is a supportive initiative that has been designed to promote regular attendance. It's not by any means punitive. The goal of the program is actually early identification of attendance issues, providing clear expectations. We meet with the staff when we notice that there is a pattern, and we offer appropriate resources or accommodation in order to eliminate that barrier for them to be at work. And that helps us a lot in order to decrease the incidents as well, or the long absences and to promote health work-life balance in all the departments in our organization.
Yeah. And so that's not just employees that are off injured, that's employees that are, you've just identified there may be an attendance. Yeah.
That's correct. Yeah, the attendance management applies to everyone in the organization, from our CEO to our staff that is only casual, and it's a matter of us to show care, to let them know that we are here for them, and to provide them with the tools that perhaps they need in order to overcome any situation that they are going through.
Great, thank you. Tara, over to you. And as an employer's advisor in your role, how do you support employers when they're navigating the claims, particularly around the return to work?
So a big piece of that is even educating on kind of how to approach it. Some bigger organizations obviously have a pretty robust return to work plan, but smaller employers often have little to nothing. So it's a matter of even breaking it down with, do you have an active job description of the worker to figure out what limitation or restrictions work with the type of work that they do, as well as what are you doing about documentation? As we all know, a lot of us are from HR. First rule of HR is always documentation. Anything that is offered needs to be done in writing. A big piece of advice I can always recommend to employers is to make sure that you're uploading everything that you're corresponding with the worker to the claims portal, so that any decision maker from WorkSafe that's going to be making those decisions around duty to accommodate or duty to maintain employment, duty to cooperate, are able to see what actions the employer has taken through that process, and just making sure that they're doing everything that they are able to do to navigate that process. They're not coming into an issue where the board's making a decision that the employer is not cooperating.
Okay, great, thank you. Dana and Alicia, and maybe Tara, you might have some anecdotal evidence as well. What would you say is one of the biggest challenges that you faced managing the claims or the return to work?
I think that we find that there's not always consistency with case managers, let's say. So from our standpoint, as Tara said, we're a fairly large organization. We have a very robust return to work program, right? Job descriptions, job demands analysis. We have preset designation of sedentary, light, medium, heavy duty amendments that can be given out to employees right away, to even to go with a functional analysis to the doctor. So it's very robust already, so that nobody is leaving our doors even after an injury without any sort of direction. But what we find challenging is that it's not always adjudicated, or each case is not always looked at or dealt with the same. So part of it is navigating and creating that rapport with your WorkSafe case manager is so important, because they're going to be a key component to making sure that everybody's on the same page while working through the claim. So we make a big point to reach out to WorkSafe as early as possible and request a callback, so that we can have an initial conversation and go, here, look, this is what we've done, X, Y, and Z. Once we get a claim number, it will be uploaded to the portal like Tara has talked about. So that's uploaded right away. And so that it's really, really open and transparent, everything that we're doing, the same way that we would be with the employee, right? Particularly with the Bill 41 requirements. So that, I think, we found challenging, but that's our biggest workaround to it, is that we reach out first. We don't wait for WorkSafe to come to us, and that we make sure that, as Tara said, it's documentation, so that it's really clear and everybody's treated exactly the same.
Okay.
Yeah, for sure.
Yeah.
Just to add to that, a big misconception that there has been in the past is that a worker has to be 100% to return to work, and opening those lines of communication right from the get-go of talking about, like, this is what we can offer you. How do you feel about this? Being transparent and having that open communication is so, so big. I always use the example in my claims management courses of if any of you have ever been on, say, maternity leave, coming back to work and you feel that hesitation, the longer you're away, the more you feel disconnected. So you have to think about how that worker is feeling through that process. And also just, we're all human, balancing the fact that you're dealing with somebody who's had something potentially traumatic, depending on what it is, something that's impacting their life negatively, as well as you're getting pressure from your superiors likely to having this claim managed appropriately. And then just doing everything that you can, but then navigating also contacting WorkSafe and everything together. So it's not always a cut and dry situation. And every claim, I always say every claim is different. You can't treat them the same, even if it's the same injury, people are different in what they need and their expectations.
Yeah,
Thank you for that. Go ahead. Yeah, go ahead, Alicia.
I agree with Tara. It is important for us to be proactive. We learned that in the past we were waiting for the case manager to contact us. Not at this point. All the information is available in the online portal. So I don't wait until I receive the information through the mail. I'm actively checking the portal. So when I get updates right away. Also, early intervention, like timely, clear communication is essential. At Lee Breyer, we do wellness check-ins, as I said, and we connect with the employee from the very beginning and guide them through the process. So in that way, we are able to submit all the forms to WorkSafe on time and provide them with earning reports, the investigation report. So they have everything that they need in order to make a decision. And of course, like the schedule, the rotation, also make sure that, as Tara said, offer light duties right away. Usually WorkSafe is really generous, and they have the desire for the worker to return to work. So they usually are very generous, offering supernumerary GRTW plans. And it is that there is no point for you to wait. If they are ready to return to work, let's provide WorkSafe with everything that they need in order for them to make a decision right away.
Great, thank you. So we talked about the challenges. Let's just flip it and I want to hear, is there an example or a return to work situation that you can think of that went really well, and what contributed to the success of that?
I've got a few if nobody else is wanting to go, but we had a quite serious code white that resulted in an injury that was not minor in nature. So there was a lot of unpacking of not only the physical side of the injury, but the psychological piece as well. So first thing we did was we encouraged the employee to take a minute before leaving the home. And we had a big conversation and really unpacked a lot in the moment from a psychological standpoint, and made sure that she already had a safe place to go to, so that when the psychological barrier, if it was going to present down the line, we already had a really good open line of communication and contact point to make sure that she felt supported when she was coming back. So one was the communication and letting that kind of almost sit for a moment and letting her be in what had just happened, because it was fairly significant. And then from there, we could then support her with the physical side. Right away, we were chatting with her about, okay, so let's not bring you back to this exact area of the home. Let's go to this area because we can put you in a different place. And right away, that lifted a weight off of her. Then let's think about, would you want to do some companionship duties as a way of like we were talking through what the steps would be before we even wrote anything out. And by the time she left, we already basically had a full week plan of her next week, maybe 2 weeks, of how we would slowly introduce tasks, with the final part being moving back to her designated area that she worked in. And it was great. It was very collaborative. She had lots of opportunity to provide input. It was all written down very meticulously, so we could just kind of gift wrapped it, send it off to WorkSafe and say, here's everything we've done. Hope that's okay with you guys, essentially, because by the time they got to the claim, it was already done. She was back full and life had moved on. But I think with something like that, the psychological part is almost bigger than the physical injury. So it was so good to unpack all those pieces, set up even before she left so that she felt good about it. And then she could call and say, you know what, I had a thought about this and I would really like to do this. And we'd go, okay, what if we did this? And it was very together and collaborative in nature. And that was great. But again, that's very unique to our industry. So I think that's one piece that we did really well in that scenario. And we had, we got a union rep, so she knew who she could speak to there. We had the direct manager involved. So there was lots of people that were all involved in the process to make sure she knew who she could reach out to, that what her rights and responsibilities were, and then what our rights and responsibilities were, so that everybody was really transparent in this. And it was great. And honestly, if this had happened a few years ago, I don't think she would have come back to work as early, because we hadn't had those discussions at the front end and we weren't being as good about documenting everything. And so it was a very seamless process.
That's great. Alicia, have you got anything that worked really well that you can think of in your workplace, an example you can share?
Sure. A recently successful return to work involved an employee that was recovering from a shoulder injury. And I think what very similar to Dana, we did an early engagement through the wellness check-in. Right after the incident, we make sure that we completed together the 6A. We submitted the 6-7 right away, and we provide her with support and guidance. And in that way, she felt that we were there for her. And she sometimes the delay of the worker being able to see a doctor is a big barrier. Hopefully, she was able to go to a walk-in clinic right away. They did an assessment on her, and they sent us the limitations, and talking to the manager and making sure that we were able to actually provide some sort of accommodation. And in a couple of weeks, she was already back, and she's been successful. She feels supported, and she also feels that we were guiding her through the whole process. But I think that early intervention is key, flexibility as well, and of course, engagement in all the different stages of the GRTW, and continuous check-ins. How are you feeling? We usually schedule a weekly check-in just to double check and see how is the GRTW going.
Great. So what I'm hearing you both say is the trust piece, the relationship building piece is huge. Alicia, you mentioned the wellness check-in. So who does that? Is that the supervisor of the individual? Is that someone dedicated on staff that's doing those wellness check-ins?
Yeah, we are very fortunate to have a attendance, wellness, and engagement coordinator. So he's in charge of doing the return to work interviews and wellness check-ins. However, I'm also really involved, especially with those incidents that require a little bit of more attention. We invite the managers if they are able to come and join us, because I believe it helps also to build a relationship between them. But we also are very mindful of their time. We send an invite through Outlook, but we make sure that they know that it's a very casual. It's mainly to support them, to see how are they progressing, if they feel that they are ready to move to the next level of the GRTW. And if not, we communicate with the case manager and with EDMP. So is our attendance management coordinator who does the wellness check-ins primarily.
Great. So Tara, Dana and Alicia have talked about some of those early interventions that they did. Are there other steps that you would typically advise employers, steps that they can take early in a claim to support that safe and sustainable return to work process?
Really, just to add on to what Dana and Alicia said, just that early communication and collaboration with the worker, and also explaining right from the beginning what the employer's expectations are versus what the employer's responsibilities and also the worker responsibilities, so that it's transparent and open right from the get-go. I really liked Dana's approach with dealing with a traumatic incident. I have a spouse who's in emergency services, so that initial debrief is so important. And really, it'll impact things like morale and retention. If your staff feel like they're legitimately cared about, they're going to tell other people and they're going to stick around and stay in those positions. Whereas if you feel like you aren't cared about at work, you're not going to stay in that position. So it impacts other areas as well.
Yeah. So Alicia, when you were talking about the worker that came back after the shoulder injury, for example, sometimes those modified duties might be a bit challenging to identify. So how did you approach that collaboratively with the individual? What did that look like?
We work really closely with EDMP. And depending on the situation, obviously, sometimes in this specific case, actually, the worker went directly to their doctor, and the doctor actually provided us with a list of limitations. So we didn't really wait until WorkSafe approved. We knew that her claim will be approved at one point, and we wanted her to stay connected with the organization. So we just follow the limitations that were mentioned during the GRTW that was provided by the doctor. And we talked to the manager. We agreed and with the worker that what were specific duties that they could do, and we support her through the whole process.
Great. Now you mentioned EDMP, and I have heard anecdotally that sometimes there's challenges around that. How have you fostered that working relationship with EDMP?
We've been really fortunate to have the opportunity to work with the same case manager for the past 3 years. So it's been really consistent. It took us time to build that relationship. At the beginning, we didn't really understand how could we collaborate closely. But at this point, I can say that we have a very open communication. I receive updates in a daily basis for the EDMP cases that are open. And I feel very confident to just even give the EDMP specialist a call and discuss the claims. The purpose of EDMP as well is to support the employee, and we have the same goal. We want them to return to work when they are ready. We want to support them. We want to make sure that they feel that we are there for them through the whole process. So it's been really, really positive, my relationship with EDMP, but it took us time to really get there. So I guess just mainly clear communication and trust.
Okay. Dana, have you had any experience with working with EDMP at all?
Yeah, fairly recently, Broadmead Care took over managing another home that does use EDMP. And I would say we're in the early stages of understanding EDMP, and like Alicia said, building that relationship. I would love to say we've had the same case manager, but unfortunately we've been through 4 with from the union perspective. So it's been a bit challenging to build that one, but our recent one, we have a very good rapport with. We actually found that setting up a meeting with them at the beginning and saying, hey, this is how we're interpreting EDMP. Here's our expectations. Here's what we would hope to see from you for support. Here's what we're going to offer for support. Here's what we're doing. So going back to kind of that shoulder injury example one, we have a job demands analysis. We've also got a list of job modification duties that we can offer out, broken down into sedentary, light, medium, heavy, above waist, below waist, left arm, right arm, so that it can be as specific of an offer as well when you're sending it to their physician. If they are going to get, if it is going to be looked at by a physician, so that there is no ambiguity again in that offer that we're making. That part has been very helpful because we kind of set everybody's expectations up at the beginning of it, and therefore there's no surprises when we get into these meetings with individual employees and the unions kind of questioning where we're coming from. They know. So I think that it has been really, really helpful.
Great, thank you. And I just saw something pop up. What is EDMP? That is my bad, my apologies. Acronyms is not always the best way to go. So EDMP is the Employee Disability Management Program. So thank you for popping that into the chat. So Dana, I know that you had said when you started where you were 4 years ago, there wasn't much in place. Can you tell me in that 4-year span, like where have you seen change? What does it look like now that you've had this focus on injury management and return to work?
So I got to start in March of 2020 too. So height of pandemic. Woo, thank you. Everybody thought I was work safe coming in, which they were happy and sad all at the same time. But we've had a huge swing with implementing kind of a 3-prong approach to claims and health and safety. One being education and prevention. So that's the wellness piece too. And I would count that in that kind of column. Then we have the return to work, early intervention, modified duties offering, gradual return to work, all in one. And then we have our appeals side of things and claims management. So we've been fortunate enough that we've kind of attacked it from 3 different avenues. And that's the whole program that we look at. And so we've had a swing from having a 30% surcharge to now having a 30% discount. So we've come a long way. And part of it is building all those resources that I've been referring to, you know, having really good, robust job descriptions, having really good job demands analysis. And that's big for us because we're operating across multiple sites. So not every cook looks the same from home to home, right? So it does take a time and it is an investment on the front end, but it makes the claim management process so easy, and it makes it so that multiple people can step in and assist throughout it. So it's not all reliant on one person. So for us, you know, a manager can take the sheet that I'm talking about from a job modification or light duties offer and just tick off, oh yeah, this is what we could offer, and then hand it off to the next person, right? So it makes things really, really easy, but it is a commitment in the front end, but it pays off big time in the long end. And then we've built example gradual return to work plans and programs too for people to operate off of, so we can talk to an employee about these things on the front end. Hey, because you have an injury that's fairly minor in nature or major, whatever the nature of the injury might be, and it's a shoulder, look, we'd be looking at a 4-week, and here's what a 4-week might look like. You can even take this to your doctor and have a chat about it, and they can write in suggestions. And then that way, again, it just starts that collaborative process from day one. So we really try to not let our employees leave their home or leave the workplace before they have the information in hand that they're going to be taking with them, either to see another treatment provider or that they've already agreed to because they think the plan's great and they have no issues with it. So that has been a really big game changer for us.
And so when you talk about going from a 30% surcharge to a 30% discount, like what does that look like on the financial side of things?
Well, we were probably experiencing about $150,000 to $200,000 in premiums on the front end. So it's over 4 years, and then now the discount, and then plus all the claim costs associated. The program's probably saved about $2 million.
Wow.
Yeah,
And
so
then
from a financial side, it's a huge incentive. And when we educate employees about this and why it's so important that they come to us and they start explaining symptoms as early as possible, we talk about that. We say, we want to invest money into more supports for you guys, more equipment, more benefits, because that is one thing that we've been able to do is we brought in telehealth with some of the money that we saved. Is now we are giving our employees access to primary care physicians, because it's a huge problem in BC, right? Nobody has a physician. So with some of the money we save here, we can invest in it here. So it makes it almost like they're invested equally, because it means they're going to get something back out of it.
Mm-hmm. And I'm going to come back to resources, but Alicia, you said that you actually hired a position around the attendance management. And so now you've got a dedicated person looking at that. You've got your dedicated role within the organization. What impacts have you seen in your own organization while you're putting a focus on that preventative side of things?
I believe that it's been a culture change. Health, safety, and wellness is a priority for our organization. Is one of our core values, and our CEO and the senior leadership team really is supporting these initiatives, and we can see a big impact. Retention, for example, the turnover rate is going lower, the morale, the culture in the organization. They know that we care. We show it to them. We have recently we were really fortunate to win the safety den through Safeguard BC, and we implemented a dashboard that actually indicates where the incidents and hazards are happening. So the culture in our organization, they see that we care, that we really want to provide a safe space for them to work. As you know, this industry, specifically this sector, it is dangerous, and it is very important for our care aides, for our nurses, for our environmental services workers to know where are the hazards, where is the issue in their organization. We want to be very transparent. So I noticed that having a position like the attendance management coordinator and my position, we've been able to remove that from the managers, and we actually are able to take an action to do that follow-up, to make sure that the incident reports get submitted as soon as possible, to make sure that the investigations are done right away, and also that there are corrective actions to prevent those incidents to happen again. So I would say that that's probably the main benefit of having two people designated to attendance management, wellness, engagement, safety, and definitely like changing the culture of our organization.
Mm-hmm. We had a question pop up in the chat, and Tara, I'm going to throw it to you, although I don't know if you can answer it. And if you can't, that's fine. We can find the answer and get back to this individual. But if you have a situation, so both Dana and Alicia have talked about the importance of that early intervention and getting the information to the employee first. What if an employee doesn't want to go on modified duties offered by the supervisor? They want to make sure that they can do the modified duties, and they want to make sure they do it after a doctor's appointment, but they don't get a doctor's appointment in a timely manner. Like that's a challenge, I guess, that this is occurring. And what would you say to that?
Yeah, so it's not an uncommon issue. One thing that I learned actually from the board that I didn't know about is if you go to the same walk-in doctor 3 times, you're actually considered their patient. So that's one thing that you can pass along. Just make sure you're booking online for that specific doctor so that they get in for those appointments. But if it's getting into the point where you've done everything right and offered them positions, offered them work, and they're just not cooperating, then you can have the board intervene and make a decision on the duty to cooperate. I'm actually working on a review for that right now, where the board has deemed that the person was just not cooperating. They weren't coming to work, even though the employer did have meaningful work for them. So that's where you want to have that documentation and have it uploaded on the claim file so that you can have the case manager make a decision if you need to. Because what happens if they determine the person is not cooperating, then they pause wage loss benefits and the worker's not getting paid if they're just not cooperating. So you have to be able to show that you've done all steps for sure. And you want to make sure just in general that you're going through and doing it properly. But if you've done everything and the worker's just not cooperating, then they tie your hands. You have to go in that direction.
Right. I'm mindful I want to leave time for Q&A, but my one last question to the three of you is if you could give one piece of advice to organizations around the return to work process, what would it be? So Dana, I'll start with you.
Oh, one. That's tough.
You've given a lot of nuggets, great nuggets of information.
I think for me, and maybe it's the HR brain that comes out, is the communication and documentation. It's just, you're going to live and die by how you communicate with an employee and how you treat them too, right? That's your support and your trust, and that's how you build it from there. But from a work safe perspective, you're going to live and die by what you have documented and what you can demonstrate. So if you do end up in situations like we just talked about, then you do have something to fall back on. It's not a place we ever want to be, but you never want to end up in a he said, she said, and you want to be really transparent. So for ours, when we offer those light modified duties, we have right on there, Bill 41, here's your responsibilities, here's our responsibilities, and here's the potential repercussions if neither one of us follows through with it. So it's not just theirs of not participating, but it's ours of not participating. So, so that's the written communication, obviously, and there's verbal too, but I think those are the two biggest pieces, and we want to be big, kind-hearted people sometimes and have these conversations and just not document it, but that's not necessarily the world that everybody can operate in, because obviously WorkSafe's not a bird on the wall hearing those conversations, so they need something to fall back on, which is completely reasonable. So those are my two biggest takeaways for sure, and you can't over document.
Hey, Alicia.
Sure. Great question. If I could offer one piece of advice to someone new to return to work process, it would be this: prioritize empathy and communication from day one. At Louis Breyer Home Hospital, we have learned that recovery is not only physical, it's also emotional. So employees need to feel seen, heard, and supported. So start early. Reach out to the worker as soon as possible and maintain that open and ongoing communication. Try to build that relationship not only with the employee, but also with the case manager, the WorkSafe case manager, and your EDMP specialist. The return to work plan is more than just a document. It's shared like a process that will build trust, empathy, and flexibility as well. So our structured return to work interviews and wellness check-ins has helped us a lot to stay connected through all their staff recovery, and ensure that they never feel that we have forgotten about them. So this proactive piece really help us to achieve better outcomes and of course to succeed in the return to work process.
Great. Thank you, Tara.
Both of those are great. The documentation and psychological safety in general are very, very important. Another aspect is don't be afraid to ask for help. You're not alone in this process, and there's always others that you can reach out to. I'm sure you all have your own kind of people to call, but you can also call our office as well, and we can talk through situations and try and figure out some alternatives for you.
That's great. I'm just looking in the Q&A. We've answered one of them, but the other one, and maybe Tara, you might be able to answer this, although Dana and Alicia, please feel free to chime in as well. this individual will be interested in some of the return to work assessments that people are using. So what kind of tools do people have access to that can help them with that return to work assessment process?
It's kind of an individualistic approach. It depends on kind of what your starting point is. Some people have templates and things to build upon, others have nothing. I always say there's often quite a bit on the WorkSafe website as well as just online in general. I always like to say ChatGPT is your friend sometimes. It can just pull up templates and things for you just to have a starting point as well.
Yeah. Dana, you talked about a number of resources you had. Were those all developed in-house?
Yeah. We, my background is starting from treating clinically, more of a physical therapy background. So, and when I started, that was the main part of the project was musculoskeletal injury prevention. And now we know obviously that violence has escalated and now that's a huge focus too. But we created them all in-house based off of doing assessments on each individual home and each individual position.
Right. Okay. And Alicia, are there any tools that you use in your workplace to help with this process?
For us, we mainly collaborate with EDMP. EDMP is the one that is pretty much providing us with the GRTW proposal. So, but we discuss together, we provide them with the job descriptions for light duties, for example. We use the light duties job descriptions from, for example, if it's a care aide that it has been injured, we use the HCAP job description, which is very light, and especially if the GRTW is supernumerary, we do not wait. We provide a day to start, and we welcome the employee on that day. We make sure that the supervisor or manager knows, and we try to meet in the first week of their shift to do the return to work interview.
Great. I also want to mention SafeCare BC does have an injury management program that we have put together to help organizations. So if you do not have something in-house, it's a great resource to start with. It has the program, what an immediate response and a return to work process might look like. And then it has an appendix with sample letters that you can use to the injured worker, to the healthcare professional. It has a functional abilities form for recover at work. Lots of templates that are useful that will be attached to the information that you get after this webinar with the recording. The other thing that we have as well for organizations that might be using supervisors to connect with workers that are off work, we actually have an information sheet on how to do that. So how would a supervisor, pick up the phone and have a conversation with somebody that's injured and off work and try and maintain those connections and try and get them back to work earlier. So those are two resources that we will send out along with information on how to contact the employer's advisor's office. So both of those will be attached, or all three of those will be attached to the information along with the recording of this webinar. And I'm not seeing, just quickly looking to see if there's other questions here, and I'm not seeing any. I think at this point, I want to say thank you so much to the three of you for sharing your insights, and to everyone today who joined us. I think these conversations are essential to strengthening how we support injured workers in our sector. And again, at SafeCare BC, we are also here to help, whether it's through tools, training, or individual support. I mentioned you'll get the follow-up email with additional resources, and you will also be able to provide feedback on today's session. Thank you again for being part of the conversation. We're so appreciative, Dana, Alicia, and Tara, for your time and your expertise today.